My name is Lexi Pierce, and I chose the historical event of COVID-19 impacting my great-grandparents that are still alive today. And this is a picture of them. So first, why does this matter? Like, why did I choose COVID-19? And I chose this because this is the one topic that my ancestors actually experienced, and one that I could interview them about today, because growing up they really didn't have one that affected them as much. And my grandparents were born and raised in Dahlonega, and when this happened they were 70 years old, both of them, in their early 70s, like 70, 71, and they were both in retirement at this time. And this really affected them because it just their lives changed because they were in retirement, so they would like to go do things and stay out and about, and they really couldn't do this anymore because of COVID. And it really had an impact on their emotional and mental health. It affected them physically too, but mostly emotionally and mentally. So, throughout the pandemic, my grandparents both almost died when they got COVID. It was really bad on them. That's how it affected them physically, was that they almost died because of how bad it was. But also, it affected them mentally and emotionally because of how they had to stay in the house, and they were really scared about COVID. So what is COVID? So COVID was the pandemic that happened in late 2019, early 2020. In 2019 was the first case of COVID. It was in November of 2019. And then in 2020 is when it really hit here for us. And then January 30th was the public announcement that was made for everyone. And in March, it was named a global pandemic. So after that whole year of stress for everyone, especially for the older people, because they were affected by it more, because when it came out, the news said that it would affect older people more because of their age, and it was a respiratory virus, so it really affected their lungs and everything. But in 2021, the vaccine came out. My grandparents did not get that, but I'm sure a lot of people did. And then in 2022, the vaccines became really big, and that's when everyone really got them, because in 2021 it was a new vaccine, so everyone didn't really know about it. But in 2022, that's when it became really popular. And then in 2023 until now, we see COVID as like a flu that just goes around. But there's that. So the risk of COVID. So COVID was very risky for older people, and that's what really scared my grandparents. And I found an excerpt from the CDC that says COVID-19 was the underlying cause of death for a total of 350,000 deaths in the United States in 2020. Although COVID-19 can affect people of any age, older adults were especially impacted during the first year of the pandemic. So that excerpt right there just shows you that during the first year, the elders were the target. They were the ones that were really affected by it, and it impacted them. And it really impacted them because of their lungs, and they are older, so they don't work as well. And then I found another excerpt the government responded with, and this was after it came out, and when it was called a global pandemic, so everyone had to stay at home. And this was an excerpt of them saying stay at home and be isolated. And it says, federal guidelines are needed to make a public health system effective, including data-driven standards, local stay-at-home orders, systematic distribution of medical supplies, and support under resourced hospitals. So after COVID came out, people didn't really know what it was, but then it was affecting older people and younger people, but mostly older people. And that's when the government was like, okay, everyone needs to stay at home. And so this is my great-grandparents on this slide. And so this is how they were affected emotionally. Okay, so like I said in the beginning, they love to go, like, eat out in public because they're on retirement, and that's what everyone wants to do when you're retired. And staying home is really, really hard for them. But they also got, it impacted them because they got it. And I interviewed them and asked them, like, what they thought about COVID after it was like a year or two. And my great-grandma said, I do not get out much because I don't want to get that sickness again. And my great-grandpa said, I want to get out and do things, but the risk is just too high, and I'm not getting the vaccine. So that was like right after the 2 years that COVID was, and they were still hesitant to get out. So emotionally, they were just scared, and they didn't know what if COVID was still around, if it would still affect them as much and everything. So that really like impacted them emotionally. But another problem that impacted them and affected them was healthcare. My great-grandma has a lot of GI issues, and my great-grandpa has MS. So they would always be at the doctor. Like, yeah, they went out and they like loved to do things out of the house, but they also had to go to doctor's appointments. And when COVID came out, everything was shut down, and they didn't really get that opportunity anymore. They had to do online appointments, which they're old. They don't really know how to work the computers and all of that stuff, so that was just really hard on them. And they didn't get the full healthcare help that they needed with this particular part of their healthcare. So that really affected them, and that made them emotionally like stressed and everything like that. So it really affected them emotionally, and because of healthcare and just being isolated like they were. But there was an at-home healthcare, and it did impact older people. So they would have like medical people come to their houses, or if they were in the nursing home, they could come home. My great-grandparents did not do that because us as a family helped them. Like if we were not sick or like didn't feel anything, like we would go and help them. But other people did, and I'm sure it helped them. I found a news article from the College of Michigan, and it says, many homebound older adults canceled medically necessary home-based health care and services out of fear of getting COVID-19. And that was also a big part of why my grandparents did it, is because they feared getting COVID from nurses that would come. And so mentally, this really affected my grandparents mentally, because they were isolated and it was just them two, and they couldn't really talk to people, and that's what they were used to. So mentally, mentally and emotionally go together, but they're also two different things. This made them depressed, honestly, because they did not get to go outside and see people. So they were isolated, like I said before, and we as a family are like really close, and we didn't start going over there until like a year after. The only time we did is if they had it, and that was that one time when we helped them. But other than that, it just like really messed them mentally. And even like years passed until like recently, they did not go out because they were scared they were gonna get it, or they didn't know the impacts of it or anything like that. So I found another scholarly article that says, furthermore, previous experiences of infectious diseases have shown that the number of people mentally affected by the pandemic exceeds the number of those physically infected by the disease. indicating massive influence of such a disease on mental health. So this shows that COVID just had a really big impact mentally on people, and especially older people, because they were told that they're more at risk, so that would make them scared more than anyone else. So this whole pandemic taught me and my grandparents and everyone in our family that first off, that family can be a huge part of your lives when you need them, because we went and helped them when they had it. But also, I feel like this affected them, but helped them in the long run, because now they're mentally stronger, and because they're not scared anymore and they're used to it now. So mentally and emotionally, they're stronger because of it. And I found this excerpt from the first person essay. After the lockdown, being stuck in the same space for 2 months can never be good. It takes a toll on your mental health, as well as your creativity and productivity. So, although they were affected mentally, they did get over that, and now they go out and they do whatever, and they're not as scared anymore. So I think that really helped them in the long run, and that's what they needed to face. And now they're just stronger because of it, and that's my conclusion, and that's my Works Cited page. Thank you.